Hello and thank you for joining me again today at the Envita Whiteboard, and we're continuing our conversation of understanding chronic disease, infectious disease, and autoimmune disease, how these three are related. And today we're going to talk about Envita's approach, and again, I don't want this to turn into a marketing piece for Envita, but Envita's approach, how do we approach this chronic disease, autoimmunity, infectious disease, what I like to call a complex of all these things occurring. Very first step is we want to get the proper diagnosis. We talked about that. That means using the best laboratories, a series of laboratories around the country to get the best testing to see what is really going on with the patient. The second step is treatment. And here's where we get a little bit interesting because there's multiple things that need to go on. We need, in part of the treatment, we need the whole body concept. So we have to get the hormones in balance. We talked about the concept of thyroid, adrenal gland. We need to talk about getting the digestive tract in order as well and balancing out the digestive health of the patient. But then we also need to go after those infectious disease agents. And it may involve the use of antibiotics intravenously, or it may, or a set of therapies that may be antiviral. But the important thing is to understand that what makes it very hard to treat some of these infections, particularly some of the tick-borne infections like Lyme disease and Bartonella babesia and some of those others, is they have something called biofilm or a sludge. And so I'm just going to do a little picture here so you can understand how come it's difficult in therapy and how Envita's approach is very unique and I think is giving us the good success we're seeing with our patients. And so here we're looking again inside that blood vessel wall. I just made that cross section. And inside that blood vessel wall, we have the infection sitting there. It's causing all that inflammation and problems we talked about. But then that emits what we call a biofilm that starts to spread. And of course, we start getting inflammation and laying down of fibrin and changes throughout the body. But that biofilm needs to be treated too. So what we do at Envita is we use biofilm agents to strip the biofilm. So then when we use our antibacterial, viral, fungal therapies, depending on the infections we're dealing with, we believe, more successful at dealing with that infection. And that's why we can see our patients getting better and responding to health sooner and being able to maintain their health. So I just want to get you an overview that the overall approach, getting the proper diagnosis, putting the plan together to take care of the whole body system, and then even targeting the infection is not always as easy as it seems. You need to deal with some of these complicating factors like biofilm. So hopefully this was helpful to you, and if you have any questions, don't hesitate to contact us. Thank you for joining me today at the Envita Whiteboard.